Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Virtual reality is the name given to that technology that allows a user to simulate a situation or experience of interest using a virtual reality headset with an interactive but computer-generated environment. Current medical training has shifted from the rote memorization of facts to imparting skills to use facts to arrive at a proper management strategy when faced with a given patient. This training includes problem-oriented learning, communication skills, and virtual reality-based learning. A cohort of Ugandan surgeons are now set to benefit from a virtual reality training session that will happen in the United Kingdom but accessible here in real time. Dr. Helen Please, currently working with Mengo Hospital, is spearheading the virtual reality conference.
In Brighton, we have a dissection room, and there'll be expert surgeons coming from across the UK and also 2 coming from Uganda who will perform operations on the cadavers in a teaching format in order that those watching can learn about the procedure. And all of this is filmed in 360. So a normal camera just takes the image in front of you, whereas 360 you can see all the way around. And then the footage is being live streamed.
Dr. Please says this new technology is meant to train surgeons to become safer and conduct procedures to a higher quality.
So what we're hoping is that this gives a way for people to access material cheaply and quickly, and it allows a scalability. So the idea is that anyone in any part of Uganda could be watching this, whether you're in a remote area up country or whether you're in an urban setting. All you need is a smartphone and good internet connectivity.
Here, it will be conducted at Uganda Christian University School of Medicine and the African Center of Excellence in Bioinformatics and Data Intensive Sciences at Makerere University.
In virtual reality, there's a range of devices that can be used, and some of them are very, very high-tech. So some of the ones you see here, the Oculus and the HTC Vive, these are high-end, they're expensive, and they require some technical knowledge. For example, this one has to plug into a computer, whereas this one is mobile. These can be purchased for around $7 to $10. However, I don't think at the moment there's anywhere in Uganda that is currently producing these, so you'd have to import them. The way they work is you open this up and you get a video on your smartphone. This is just actually a video of skydiving rather than anything surgical. Then there's a facility to split the video into virtual reality headset, which means you have 2 small screens, 1 for each eye. Then you place that into the headset, secure it, and then you can really see as though you are where the video is being played. And the nice thing about this is it's scalable. This is affordable to those living in remote and rural areas who want to train. There's quite a shocking statistic that more people have access to a smartphone than to a toilet worldwide. Yeah. So all this is a phone and cardboard. So this is really something new we're trying, but we hope that this is something that everyone can use in any setting. The biggest challenge is data connectivity, because to watch the phone video, you do need a lot of data. And then there are things in between. This, for example, I think it's about $25. It's also using your smartphone, but it's a more robust headset. It allows a higher quality experience. The reason we're not using these for the conference is we want to look at the most scalable option and something that's really accessible for anyone and everyone.
But a team of 6 doctors from Uganda will join another 4 from the East African region to attend the training conference physically in the United Kingdom. Dr. Richard Ndiwalana, a gynecologist and obstetrician at Mengo Hospital, says the opportunity will bridge the gap between training and continued professional development.
Because even in our training, there are some concepts or even surgical procedures which you finish minus observing or even performing. So here we are seeing in virtual reality they have like a lab whereby they keep all those surgical procedures which are being performed. So you can access them anytime.
His colleague, Dr. Henry Luwesi, who heads the Department of Surgery, is more impressed that the training will help to increase on the number of the much-needed cadres.
This innovation is going to help us to reach out to our colleagues, especially in a rural setting, remotely, so that we can train them, so that they can provide adequate surgical care to Ugandans who cannot come to Kampala. A surgeon should be trained by a qualified surgeon. So first of all, we are few. Secondly, these few surgeons are busy providing care, so they may not get adequate time for training.
Uganda has about 200 surgeons for a population of 45 million people. Dr. Luwesi says the burden and unmet need of surgical care is enormous.
Getting in our surgical clinics, we are seeing between 80 and 100 surgical consultations. And out of these, you can get out over 10 who require surgery, who need to go to theater for a surgical an operation. So that's quite high, and that's way low below the WHO standards, where it's recommended maybe not more than 20 consultations in a day, and not more than 5 medium-sized operations in a day.
Dr. Daudi Jingo is the director of the African Center of Excellence in Bioinformatics and Data-Intensive Sciences. He says the fusion between virtual reality and medicine is a major breakthrough regarding provision of medical care.
Virtual reality can be used to treat something like pain. So if I show somebody an image of their leg in a much better shape than looking at it swollen, they might feel less pain. I could create a theater here so that if I am training a medical student how to cut a cadaver, the dead bodies, how these medical students are trained, I can create that cadaver in virtual space, and this medical student can literally interact with it, cut it apart, identify the veins, identify the heart, and learn. And the importance of that is two-dimensional. One, that medical person is able to do that cheaply, because if I was to use a real cadaver, it would cost a lot of money.
There is no doubt that necessity is the mother of innovation, and that's what the team at ACE here is doing. They believe they are going to be able to sort out challenges within the health sector, like improving skills for our health workers. Walter Mwesije, NTV, Makerere University.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities.